Moving on to our next speaker, she is the host of the R as well, and she is none other than Dr. Ruhi Aggarwal. She is a co-founder at the IAFM, a medical doctor practicing functional medicine, and holds a degree in global health as well. She, with her husband, Dr. Ashwini Garg, actually have opened up the functional medicine clinic. She will be speaking on circadian rhythm, the way of health. Dr. Ruhi co-founded Functional Medicine Clinic to help people reverse chronic conditions by addressing the root cause of diseases rather than just treating symptoms. Through her hormone reset program, she has helped many women suffering from autoimmunity, PCOS, thyroid disorders, infertility, restore their health and be vibrant again. So her other venture is the Dr. Juice, a healthy food line in Bengaluru as well. I'll repeat that her topic today is circadian biology, the way for health. Over to you, Dr. Ruhi.
Thank you, Dr. Krishma, and very good evening, all of you. Okay.
Yeah, we can see the screen, and you're loud and clear as well. Please go ahead, ma'am.
Thank you. So, health needs a holistic approach, and because there are various aspects to health, only one thing cannot keep us healthy. So today, at least we are trying to move away from, drugs to right kind of food, understanding what kind of food is good for your body, understanding how to eat, when to eat. But something that's much more important than food, which is often overlooked, is circadian rhythm, is your match with sunlight and darkness. So in the modern world, we are very disconnected with sun, but at the biological level, we are closely connected with the rise and fall of the sun. Unfortunately, with all the technologies around us and with the lifestyle we have today, we are getting disconnected, and it's taking a toll on our health. So this session is my humble attempt just to bring that perspective back, bring our focus on circadian rhythm, which is driving our metabolism, which is driving almost practically every aspect of our health today. So I'm sure most of you would have experienced it, right? When you have a jet lag, you feel terrible, you feel tired, you feel groggy, you're dehydrated. I mean, it's worse, right? Imagine if you are experiencing this every day. The jet lag happened because you are in a different time zone. Today, most people are struggling with this on a daily basis. And because it's on a daily basis for them, it's just so routine. So unfortunately, this routine thing which has become for them, imagine on a compounding basis, if this is happening to them on a daily basis, the toll it's taking on your health. So this is exactly what disruption in circadian rhythm is like to our body. That's how it can make you feel. In simple words, circadian rhythm is the 24-hour rhythm. It's an internal biological rhythm that every process in our body follows. As simple as that. So if someone is sick, of course, our body needs nourishment, our body needs that supplement, it needs an antioxidant, and all that's okay. But then what is really driving all the processes in our body is the circadian rhythm. And this circadian rhythm is closely aligned with sunlight and darkness. And there are biological clocks, and these clocks are in every tissue, every cell, every organ of our body. And these biological clocks are driven by a master clock. And this master clock is there in our brain. It's in the suprachiasmatic nucleus situated in the hypothalamus. So basically, it's like a thermostat, which is taking cues from sunlight and darkness. And based on that cues, it turns on the clock or turns off the clock. And based on whether it's on or off, are all the processes in the body, all the physiological processes, the hormones, the neurotransmitter release, metabolism, everything is driven by these cues on which the SCN is acting. Now, the suprachiasmatic nucleus has to sense light and darkness at the right time. If it is sensing light at night, it will create a chaos. If it is sensing darkness in the morning, it will create a chaos. So it has to sense light in the morning and it has to sense darkness at night. And that's why I again want to stress on our body needs light, our body needs darkness at the right time of the 24-hour cycle. And so this internal clock becomes very, very critical for our health and well-being. Now, this is what a 24-hour rhythm is like. So I'll start with evening. As the evening sets in, around 9, the melatonin secretion will start, and that is stimulated by the dimness of the lights. By the night stepping in, darkness is what secretes melatonin, and it induces sleep. Your bowel movements will slow down, liver will start doing its work, your cortisol levels will decrease, and you go into sleep. You are at your deepest sleep at 2 p.m. and 2 a.m. And, around 4:30, your body temperature will be low. And around 6, 7, that's when the time when you have to wake up, your blood pressure will rise. Your cortisol will also be at the highest at that point in the morning. And that's when your SCN needs sunlight. You need to expose yourself to the sun so that it can start clearing up the melatonin out of the system, and the cortisol level will go high. Your neurotransmitters will start releasing and the other hormones will start working. The bowel movements also starts going on, and by the first half of the day, you're done with your bowel clearing, etc. Your digestion starts improving. Around 9, your testosterone is at the highest. And during the day, as the day progresses, your alertness, your coordination, your reaction time, all that increases. And that's how you perform very good at work. And then as the evening steps in around 5, your cardiovascular efficiency, your muscle strength is very good. And that's also a good time to work out. And then again, as the light starts dimming, your blood pressure and body temperature will peak. And then again, the cycle starts. So this is the 24-hour rhythm that nature has built in our body. Now, imagine if any of these processes are affected because there was a mismatch. Imagine if your clock, which you're using every day as a timer for yourself, if it goes off by 5 minutes every day, your entire routine will be disrupted. And every day it is going off by 5 minutes. Imagine your whole schedule will be all over the place. And this is what is happening to our body today, that every day we consciously, unconsciously are making choices, which is moving our circadian rhythm by some time, pushing it away and disrupting our circadian rhythm and moving our health into, into illness. So circadian rhythm, the 24-hour cycle, is not just important for maintaining the sleep and wake cycle. Of course, during the day, under the influence of sunlight, we are making melatonin, which is important for sleep at night. But this circadian rhythm has a whole lot of role to play, which I just explained in the previous slide. It's important for the hormone release at the right time. So basically, hormone release, all the physiological processes, metabolism, neurotransmitters, all these are pre-programmed, and they are pre-programmed by the circadian rhythm. So that's how critical it is to maintain the circadian rhythm, because we don't want any of this pre-programmed mechanism to go out of place. So the hormone release, the neurotransmitters release, the metabolic function, because circadian rhythm is so important for the mitochondrial function, which drives the metabolism. At night, you want your digestion to slow down, and during the day, you want your digestion to, speed up. If the opposite happens, again, it's a chaos. At night, you want your body to repair, right? During the day, you want your metabolism to be high. So that's how it should be. But today, until our eyes are open, the mouth is open. So there's completely a mismatch between when the digestion should happen, when the metabolism should happen. So our body temperature is influenced by the circadian rhythm and a lot of other processes as well. So again, as I said, if this internal clock is shifted on a daily basis, imagine the compounding effect it will have over a period of time. Our body can take stresses. Our body is highly adaptable, but then we cannot take it for granted. We cannot keep exposing it to stresses and expect it to be adaptable all the time. Just like, human behavior, humans in a, any individual can take nonsense to a certain limit. So same is our body. It cannot keep, it will not keep pace with us if we just start taking it for granted. So to a certain extent, it's okay, but then we will have to, take charge and put this internal clock back into rhythm. And if not done, we are just making our bodies prone to being exhausted all the time, calling for depression, anxiety, panic, metabolic dysfunction, autoimmunity, and you name it. Most chronic conditions today are stemming from disrupted circadian rhythm. So this is what our suprachiasmatic nucleus is supposed to be experiencing. We wake up in the morning and the first thing the cue that it should get is the sunlight, bright sunlight, okay? And that will trigger off all the processes in the body, that will trigger all the other biological clocks in every organ in our body. But today what's happening is, during the day, people are hardly going out in the sun, okay? The first thing they see in the morning is the mobile phone, right? And again, sun has a complete spectrum of light, while the mobile phone has only blue light. So you're just exposing your SEN to blue light. So what it really needs is the broad spectrum light. Second, at night also, it is still experiencing bright light from the laptop, from the phones, from the TV, or from the lights in the house. So for it, a sunlight or blue light, it is just sensing light. So the moment it senses light, it will just trigger all the processes, the physiological processes that it's supposed to, because it's programmed like that. So we are just giving the wrong cues to the SEN by exposing ourselves at night as well to bright light. Because that's the time when the melatonin secretion has to start. The processes have to slow down, but no, we are still exposing it to so much of bright light. So in very simple words, as the daylight fades down, the brain signals that that darkness, the melatonin melatonin secretion will start, and metabolism will slow down, your body temperature and blood pressure will drop, and your sleep cycle starts. In the morning, as the daylight emerges, you expose yourself to sun. That's the signal for the brain to start all the processes. The melatonin starts clearing up, cortisol spikes, and then all the other hormone release starts up, metabolism speeds up, your body temperature and blood pressure will go up, and your day starts. This is how we are designed to be. But unfortunately, it's the opposite what we are giving our body today. Now, there are various epigenetic triggers: food, toxins, infections, a sedentary lifestyle. There's so many epigenetic triggers, and circadian rhythm is another epigenetic trigger. During this 24-hour cycle, 20% of our genes turn on and turn off. Now, if you are not in sync with sunlight and darkness, the epigenetic trigger that you're giving to your body is not right. Okay, so our body needs to get that right exposure to sunlight and darkness at the right time so that it can correctly turn on and turn off the genes. If in the evening you are exposed to bright artificial light, before going to bed, you're still exposed to laptops, phones, you are scrolling your phone at night, you're eating late in the night when it's time for the digestion to slow down, you're working night shifts, all that is just shifting your circadian cycle. And over a period of time, it is just resulting in too many chronic conditions, including cancer. Just to give you an idea of how profound impact disrupted circadian rhythm can do to our body. First of all, it is triggering inflammation in our body, and inflammation is the root cause of most chronic conditions. It weakens your immune system. I'm sure most of you would have experienced it, that if you have not slept for a week, if you have not exposed yourself to sunlight for a week, 10 days, right, in continuum, your immune system gets weakened. You're increasing the risk for cancer. Your metabolic health is not good. Your cardiovascular health is not good. Your hormones, their program is all over the place. Autophagy is not happening. So, of course, you're aging faster. Toxins are not getting cleared up. So, you're just making your body prone to infections. You're making your body prone to cancer. You are at an increased risk of psychiatric disorders, neurodegenerative conditions. Your memory can be impaired. Rates of depression and anxiety have shown to be increased with disrupted circadian rhythm. And of course, you will see a strong dip in your energy levels. You will feel much more fatigued, sleepiness. And above all, we all want to die when it's time to go away from this world. We don't want to die of any sickness. Disrupted circadian rhythm is dramatically increasing your overall risk of dying because of any sickness. A very critical role circadian rhythm plays is in keeping our mitochondria up and running. Mitochondria is the powerhouse of every cell in our body. It's like our engine, our body's engine. It runs on mitochondria. If your mitochondria is not healthy, your body cannot run. And circadian rhythm, as I mentioned earlier, it controls the melatonin secretion from the brain. Now, most of you know melatonin is responsible for sleep, but it's not just the sleep hormone. It is a very important antioxidant. It's a free radical scavenger. So in the mitochondria, as it produces ATP, a lot of free radicals are generated. There is oxidative stress, and antioxidant is needed to protect the mitochondria, and melatonin is one great antioxidant. So our body needs optimum levels of melatonin also to play that antioxidant role. Now, if you are not giving that darkness at night to your body, it's not able to produce enough melatonin. As a result, of course, your sleep is disrupted, but then your mitochondrial function is also declining. And when your mitochondrial function declines, your body's efficiencies decline. So now again, imagine on a daily basis, if you are just watching TV or a series at night when you're actually supposed to be already in bed, you are almost producing 50% less melatonin on a daily basis. That means something which could have helped you in anti-aging, which could have helped you reduce your oxidative stress, you are just going deficient on it on a chronic basis. So imagine the damage it's doing, you yourself, the damage that you're doing to your body. And poor mitochondria means chronic fatigue. Now, disrupted circadian rhythm also leads to brain fog and fatigue. And how does it cause that? Of course, your mitochondria is disrupted, and disrupted mitochondria means fatigue. Disrupted circadian rhythm, again, it's an epigenetic trigger. So it can cause changes in your gene expression. It does not allow the autophagy to happen. And autophagy is a process by which the dead cells, the senescent cells, the cells basically kill themselves. So that is not happening. The cleaning process is not happening. So again, you're prone to brain fog and fatigue. Because the mitochondria is not functioning, your brain energy is not replenished. Your hormones are disrupted. Your cortisol should be high in the morning, but now your cortisol is also high at night. So you're having difficulty to sleep. Your blood sugars are high when you wake up in the morning. Your thyroid function will be disrupted. Your other hormones, leptin, ghrelin, which are the satiety and the hunger hormones, they are disrupted. At night, your liver works on repairing and detoxifying. Now, if your circadian rhythm is disrupted, your detoxification pathways cannot do that work. This disrupts the clearance of the toxins, and that's why people do experience brain fog. Your endocannabinoid system, which keeps you elated, that is depleted. And of course, it will cause an imbalance in the neurotransmitter. And that's why in clients who are struggling with depression, anxiety, autism, and other, related condition, give them at least an hour of good sun exposure every day for a few days, and you see the difference, what it makes to them. Again, autophagy, a very important physiological process in our body, which helps in increasing our energy levels and lifespan. It is disrupted if our circadian rhythm is not in place. Very important thing, someone who is obese and someone who is struggling to lose weight. Well, obesity is not about too many calories. It's not about not exercising enough. It begins in the eye. And why it begins in the eye? Because your eye has to be exposed to the complete spectrum of light. And if you are just exposing your SCN to artificial light when it is supposed to get sunlight, you are starting that process of metabolic dysfunction. So it's very important whether, people who are struggling to lose weight, they'll say, I'm eating right, I'm doing my exercise right. When are you exercising? If you are exercising at 7 or 8 p.m. at night, you are just disrupting your circadian rhythm. If you are eating at night, again, what cue are you giving to your body? So it's very important when you eat also. We have to eat when the sun goes up, and we have to sleep when the sun goes down. If we are still eating when the sun is down, our body is not used to that. And if you're eating every 2 hours, that's a prescription for ill health. Now, when you do not get enough sun, your body still needs vitamin D. So what happens? Your LDL cholesterol will go up so that it can make vitamin D. So that's the body's mechanism to somehow compensate if you are not going out in the sun. Now, if you want to get an idea whether your client or you yourself, you need a circadian rhythm reset, look for these signs and symptoms. Look whether you feel tired and experience sluggishness throughout the day. You've slept enough, but then you're still tired all day. Your energy level is usually low throughout the day. Your sleep quality is not good. Maybe you're able to go to sleep, but then you wake up at night. You're finding it difficult to lose weight. You have strong cravings, and your body is running on coffee or tea or sugar. You just feel like consuming it all the time. And somewhere you feel you are diagnosed with hormonal imbalance. So if you have any of these, if your body is giving any of these signs, you need a circadian rhythm reset. This is again an overview of common problems that you can see in your clients or see in yourself, which can be because of circadian rhythm disruption. So now the question is, can you reset a disrupted circadian rhythm? So it's beautiful how nature has designed the processes for us, and it also gives us a chance to correct it if we somehow manage to disrupt it. So yes, you can reset a disrupted circadian rhythm. And let's talk about the circadian rhythm reset protocol. So light is important. You cannot ignore it, okay? But there is a difference between light for vision and light for health. It's not the same, okay? Light for health is sunlight, okay? So the first biohack, if you want to reset your circadian rhythm, is to get light at the right kind of light at the right time of the day. So expose yourself to bright sunlight as the first thing in the morning for at least 10 minutes. If you can do it longer, nothing like that. But the first thing you should be doing is exposing yourself to sunlight. And when you do this, your cortisol goes high, melatonin is cleared up, and it stimulates the release of other neurotransmitters. And that's a good start of the day. Now, how much light do you need? So every day, at least 30 to 40 minutes, you need it every day. And the first thing should happen is in the morning. Do not wear a sunglass, do not wear a blue blocking glass and go out in the sun. Well, that's not the sun you want. You are then just preventing the suprachiasmatic nucleus from getting its cues. So it has to be a naked eye and a good sun exposure. Even just sitting next to the window will not give you the kind of sun that you need to reset your circadian rhythm. But yes, it will be good to have your workstation next to a window. But when we are talking about proper sun exposure, you have to move your body out and go out in the sun. Second is limit your screen time. Well, since yesterday, we have been hooked to our laptops for the IAFM conference. That's not a great thing, but yes, that was the best way we could conduct this IAFM. But on a general basis, limit your screen time. Now, our body cannot differentiate between sunlight and blue light from the gadgets. So it's important that during the day, we maximize our exposure to the natural sunlight, and at night, we give it darkness. So that's very important to bring back the circadian rhythm. And before you go to bed, at least 2 hours before your bed, do not expose yourself to phones or laptops or TV. If at all you want to watch TV, it should be before that, or you wear a orange blue light blocker. And also the lighting in the house matter a lot. It should not be a Diwali every day. So during the day, no artificial lights. It's best to stay in the natural light. And as night steps in, use dim lights only. Do not use very bright lights. You have to give that environment, those cues to the body that it's time for night. It's time for your body to start preparing for sleep. So these are just some hacks for reducing the blue light exposure. Change your settings, avoid fluorescent lights in the house in the evening. You can choose the old style filament bulb, which has a broad light spectrum. And of course, you can get a blue light blocker. Darkness is healthy. We have to embrace darkness. So if we want good sleep, if we want our body to get the cues to slow down the physiological processes that it's supposed to, you have to embrace darkness. And one very important thing, our eye is very sensitive to light at night. So you also want to reduce that sensitivity to light. So get the evening sun. That's wonderful way to communicate to the SCN which time of the day it is. And to add to that, it's also a wonderful way to experience gratitude, which is often missing in our lives. And try to keep a regular sleep-wake cycle. Keep your schedule constant on a daily basis. Avoid caffeine and alcohol. Do not binge on it. And caffeine has a half-life of 6 hours. So do not take it after 4 o'clock. So this is what life has become today for most people. Tired, groggy, fatigued, all the day sitting in front of the screens. So if you want to change this, you have to change the scenario, go out and get some sun. That's the only way we can have a circadian rhythm back in place. So thank you. That's all from me.
Thank you so much, Dr. Ruhi. I guess the bestest topic in terms of the generation that's facing challenges in terms of work, career, economical things, but the health is also very important. Dr. Ashwini sir has beautifully answered that in the chat box as well. One question that is interesting, that what about people who are actually working late night, like they're working in the call centers? What is the best tip that you can give to them?
So the best tip is wear blue light blockers, wear orange blue light blockers when you're working at night. And so that's definitely needed if you want to kind of, protect in some way. And the next day during the day, get sun. And also the eating habits also should not be disrupted a lot. because usually people who have these night shifts, they keep eating throughout the night.
Yeah.
No, that should definitely be avoided. They have to finish off their meals before they start their night shift.
Thank you so much, ma'am. All of the questions have been answered, so there's no need of the same. Thank you so much for joining us as the speaker, and it was really an insightful session. Thank you.